Wow, who's running this? Oh, here we go. All right then. You got it all set up all day? Yeah, we have the regular.
Yeah, it's there. Check.
Squad 5, you guys ready?
Yeah, I'm ready. You guys ready? You ready?
I'm ready. All right, we're getting started, everybody. Everybody pay attention, please.
Okay, you guys get a call for a young female, and she's throwing up vomit.
All right, so coming on to see where am I at?
She was.
Hold on 1 second. Hold on 1 second. Oh, skip the picture real quick.
She's at a restaurant with her friends, and she went to the bathroom and is throwing up vomit in the bathroom.
Okay.
And now she's currently in the bathroom, like sitting down on the floor, and she looks out of it.
Okay. So, so I'm gonna come up to it, and then can I talk to her? So, hey, ma'am, how are you doing?
It's like,
Recruiting
hey,
with Cab Fire. She able to talk to me? Like,
yeah, she can talk to me. And he's looking, there's some throw up on the floor with a little blood. Okay. She's acting a little loopy.
okay, man, I'm gonna check your breathing and everything.
Push, analyze, connect, electro.
She's talking to me, looking at airways, she's puking stuff. Can you guys get it ready? But she is talking to me, so I can talk to her. It's like it's open at the moment.
Her airway is open and clear.
Cool.
Right now, we're gonna take the blood pressure.
It said something was wrong with this yesterday.
It's working now.
There's yeah, can you follow? Okay, I just all right, so so I'm gonna try to move her out of the bathroom so it's cramped.
All right, she throws up and we notice there's blood in
There's
her
blood in
vomit.
the vomit.
Yeah.
Okay. Yeah. we saw it. And we're gonna take the blood pressure. Clear.
All right, you clear it out and her airway, like she's, like she's breathing good.
We have SpO2 on. Can we get SpO2, please?
You got a 92 SpO2.
Okay. You got it? Okay. Is it? I mean, she's able to answer my questions, so I could ask her questions while she's not.
Her friend is in the bathroom with her.
Okay, so I'll go either way. Okay. All right, man. So what happened when I started?
The friend says that they were eating out and she goes to the bathroom and she usually, she's bulimic.
She's
Her friend tells me that she's bulimic and that every time they go out and eat together, like she'll go and purge.
Is she allergic to anything she had eaten?
She says, no, I don't think she's allergic to anything or anything like that. I just know that she's always real sick because she doesn't usually eat that much. And whenever she does, she throws it up.
Okay. And does she have any medication to help with that? That she
Well, I think
prescribed her
she takes, she goes to a therapist. I think they give her antidepressants.
Okay. Is there any other serious medical issues? Is she pregnant? Is she
You look
any
at
other
her, she doesn't-
gastrointestinal?
She's a young 20-year-old female, doesn't
Then
appear to be pregnant.
okay. Yeah. As I'm looking at her eyes, it's supposed to be uneven.
No, that's don't mind that. Her
Okay.
eyes are good to go. She's fertile.
Okay. Her head or anything? Did she fall or anything like that?
No,
Does she have any like rashes around her mouth, face? It looks high, something like that.
Yeah. No, her skin is a little pale.
A little pale.
Yeah, pale.
What about like sweaty?
A little
A little sweaty? Probably. I don't know. Can we get a temperature too? Coming down. How she's like coming down. And then I did feel a pulse down here, correct? It feels weak down here, but I should have. Coming down. What about coming down her chest and everything? I'm gonna palpate her stomach.
Her stomach's pretty good. Nothing in the stomach that you notice abnormal.
Yeah, legs and everything fine.
Yeah, as you go down her legs, you don't notice anything out of the norm. You got her temperature, she's at 98.5. You guys get any other vitals on you?
Yeah, we got
Blood pressure cuff on there.
Okay, her blood pressure is 100/70. SpO2, now that she's on a non-rebreather, is up to 96.
heart rate.
Heart rate is at 110.
How old is she?
20-year-old.
All right, then the onset. This started about how long ago? She was.
She said that they were just now eating dinner, and I guess when she purged, is when she found her in the bathroom purging, and she's tough. They found her all there.
Okay. So she's been thrown up probably, I don't know, 20 minutes. No, not like all day or nothing. Does she have any pain? And is she feeling any pain anywhere? Just no, upset stomach. Any burning in the throat area?
Yeah,
Chest.
yeah, her throat hurts. And she's throwing up vomit.
Well, you called ALS already, but they won't be, so they're gonna say something. You can update, yeah, because we didn't say anything. Can you please?
What's the problem like?
You said there's blood in it, but there's no food at this point.
Bloody vomit.
Can we get a glucose, please?
Glucose is at 60.
Glucose is 60.
Don't want to give anything.
Temp of 98.5. She was found in the bathroom throwing up. There is blood and vomit. Throat hurts. She has a history of anemia.
Yeah, you don't want to
And
get
this has been going on for about 20 minutes.
Claire. Yeah, I'm gonna have it.
And can we get an update on the time for the ALS report?
So she's low on fluids and a little low, excuse me, on her glucose. Can you ask them, give an idea of how much we should. So, what is D50? Yeah, so double check with them, I got D50 and IV, double check them because we don't want to give it oily. And then, yeah, I guess how much?
Do you recommend giving her like 50 via IV and the glucose as well, bring up blood pressure a little bit?
They're coming back. They go, yeah, give us. And the normal saline,
And
then how much?
they already. Blood pressure, not crazy low.
What do you do? Just
TKO after we.
because I mean, even the glucose is a hell of a, so it's not like gonna kill it.
I can ask for a flow.
You can just ask. Okay, can we get, let's just set that. No, don't turn it on.
Oh, yeah.
After we administered this, we like, what, like 5 minutes or something, to get a.
So what are you guys? I heard, I think saline.
So we
What else were y'all getting?
We had called them and gave them B50 and saline to try to get their glucose up a
Gotcha.
little bit.
So
We just checked back with the flow
I don't
rate.
think so.
for TK.
No.
We gotta do it to the trash.
yep. So hang on. Full trash can over here. Okay, so it's in the vein. That's how you're pretending. Okay, so tell me what you're gonna do. Let's do this one right here. Okay. So what do you give it? What drug do you give? Reconfirm. And how much are you giving?
How much?
So all you gotta do is what? 50% dextrose. If you're giving the whole thing, I'm giving you 25 grams. All right. Is that what
Let me ask you what a should be like. See if there's a
Yeah,
culture.
I mean, I just said,
Yeah, you just want to be mindful of concentration, and that's what you're looking for.
We're currently pushing that. Doing, closer. Thank you.
Show the B50 in.
BLS 5 minutes or.
so what do you have? Should we did a
Yeah. If you don't mind.
Okay. You guys have given me the song track.
No, yeah.
You guys get returned. You guys, any other meds other than B50?
say saline almost.
You got saline. How much of the oxygen?
How much did they end up giving?
I mean,
TKO.
no bullets.
No bullets, just
Okay,
TKO.
her blood pressure is the same and her glucose is at 170. Blood pressure, let's say 101 over 72. And she's like kind of doing cognizant now, but she's still a little confused.
Can we get a pulse ox? Pulse ox?
Pulse ox, you got her on O2 and she's still at 95.
And the heart rate as well.
You said she's a little more so.
Heart rate is still tacky. She's at, oh wait, yeah.
Well, it'll show up on the pulse ox. It's just, it's on her.
Okay.
So we're giving you the heart rate of the pulse ox, not the true heart rate, but the heart rate of the pulse ox.
Okay.
You gotta hate that. All right.
Her new heart rate's 100. I got 100 on her heart rate. Is that
30? Yeah, you're about right. It's about 107.
Okay. So she's able to talk to me a little bit better. Like, how is she feeling? The answer, she's able to talk to me a little bit better now. or-
You can ask her a question.
Hey ma'am, how are you feeling after the,
It's like, oh God, I don't feel good.
are you lightheaded or anything? Are you still feeling like you got to throw up?
I feel sick. I feel so good. I feel like I might throw up again.
She's cautious.
Oh, grab the.
When she throws up, it's only like a little bit, like she's got nothing. left
She's
in her
nothing like
stomach.
this.
Give us a ride. They're trying to find you. Can you give us an update on your location?
We can give them food. I guess ask them if you can give them more food.
Okay. I don't know.
I didn't know.
That's what I do. Wrong restaurant. Will be around about 4 minutes. Clear out the towards more or something.
We called and they said administered how much? 250 to keep her hydrated. Since she's I'm not going to keep it down any other way.
Okay. Yeah, I'll hold it.
And then, so how's her skin and stuff feeling now? She's still
Okay, you give
hot
her the
and clammy and
bolus and
stuff.
stand by. Thanks, sir.
Yeah.
She said last one. Olympic. 30 minutes ago.
Okay.
Well, I mean, what, however much time before we got, because she was at the restaurant. What's up, Sarah?
Okay. What was your question? What do you guys need to do?
No, we were just talking about that.
I was, yeah, we were just running down also. So after we gave her that, like, she's still just sick.
Yeah, she's still pale. And looks like she's, I mean, a little better, but you can still look at her and tell she's still sick. Shocked.
That's what she from the cold or anything.
Yeah,
Is she hot or cold?
she's cold.
What did Mexico say?
When you get a new set of eyes.
Yeah.
Respiration still the same? It's
Yeah,
still similar?
her respiration, she's still, she's at 23. Blood pressure is 107 over 70. Her SpO2 is at 95 still. And her glucose is up to 170. Nathan? Yeah. Oh.
So how far?
Okay, so I'm gonna have to wrap it up because I want to do the review.
Okay, gotcha.
So ALS gets here, they take report from you, they'll make your call. So what you got?
She has a 20-year-old male at the restaurant she was eating. She has a history of
Bulimia.
bulimia. She wasn't keeping down her food. She went inside the bathroom, restroom, started puking. To the point where she wasn't throwing anything else up. So we called med control and tried to give her, she was a little low on glucose at the time, so we tried to give her something for that. And also keep her
Did or you
hydrated.
didn't give her something?
We did, we gave her, how much, what was it? How much?
25 grams.
25
Okay,
grams.
Sterile empty 50. Okay.
Yes, sir. And also fluid, we administered the first 1,000 and then get 250 to keep her hydrated.
So she got 1,200.
It was just 250.
Oh, 250.
So
So,
the first one. you gave it.
okay. Okay. To keep her hydrated as well as we could.
Okay.
And she's still not feeling too well,
Okay.
but she's not throwing up. She's just like dry heaving now.
Okay. What's your field impression?
Something like that. Some sort of, yeah, like nerve GI. I think I was right. The one where they told me I'm from there. The one where like they can't hold it down or anything, so they throw it up.
I think
Could be a probably
Is it the burning in the esophagus? It is.
I'm sorry. No, I don't know.
some sort of tear.
Oh, she was
Blood,
bleeding
blood,
too.
blood. Okay. All right, then. Thank you for that. All right, so let's start with this is going to be a pretty good scenario to go over. So I like it. There's lots to talk about. So let's talk about what they walked into.
All right, so you guys had a 20-year-old female bulimic patient, and she was vomiting out blood. And you guys got to her, she was shocking. She was, hypovolemic. Being a bulimic patient because of she was also vomiting a lot. She had low glucose. She was altered. And there was a few things going on. Our intention was you guys to find out, was to treat the symptoms, really, not really try to. There's a lot going on.
Yeah.
So just how do you fix what you can? You know, that was kind of our.
So Henning, what do you think? How do you feel? How's the team do?
I tried to keep that in mind, like treatment symptoms, but then I feel like I was like halfway through, I think, like after I did my initial portion, I immediately went to like, oh, what is it?
Right. Well, I mean,
It's
you
kind of
didn't do
like-
anything. I, as far as the checking your primary, you did fine, in my opinion. There's some stuff we can talk about as far as the treatment of symptoms. But all in all, I think it did well. I really do.
Team did well though. They were always helping me out, kept calling up, giving.
I mean,
me
how could you make it that
advice.
sore, John?
Yeah.
I mean, at one point in time, I thought he was asking the girl for the phone number, but he says he was checking the airway. He says he's checking the airway. I don't know. He says he, like bulimic. I don't know.
Psychic patient.
All right, evaluation team.
I agree. I think some things went well, some things
Yeah.
could have been explained. Remember if you have like a shocking patient like that, remember to stay on the general impression to kind of see after you administer something, not just when you administer something, but just to see, how they're doing, what their appearance looks like. We waiting for you guys as far as the treatment.
Yeah.
In my opinion, if you have somebody shocking, I wouldn't too much to worry about the glucose per se, but just trying to see if you can kind of help with blood pressure. Don't be afraid to use medical control if you don't know something. Like if you kind of just trying to figure it out, you don't really know what's going on. Use those guys. But definitely some good perspectives. So,
Let's go on that, what you just said about med control. I think they tried to use med control. I think you, at one point in time, you asked med control to do what?
I feel like I asked them a lot. I asked them I think the initial one, I asked if it was a good idea to give them blood glucose and saline to bump up their blood pressure.
I think it was. I think what happened was a little bit of a communication breakdown. I think, because you said to Kirshner, hey, call med control, see what they think about some IV fluids, I think is what you said, and about some D50. And so he did call med control about IV fluids. but he didn't really discuss an IV bolus of fluids. And so let's bring in med control. Good time to bring him in. Med control. So what, in your head, what did you see the patient to be? What did you think was going on? They told you, I think you said they're vomiting blood, right? Vomiting blood. They gave you a pressure, which was initially what, 110? 100 over 70. Pulse rate initially 110. They bounced this over to you about IV fluids. So what were y'all, where was your mindset at? Hypovolemic? You felt like that? Okay. And so you guys come back with an order for IV normal saline TKO. All right, so this brings up a good point. So there's going to be times when you can bounce stuff off med control. And then there's going to be times when you got to be specific of what you're thinking. I'll give a quick example. I had a pregnant female, 25-ish, if I remember right, almost full term. She was 32 weeks and she was in BTAC. And so I gave her some medication right off the bat to fix it and it didn't work. So I called med control and I'm like, hey, this is what I've done. This is where we're at. I had one more drug that I thought might help. And then I said, what are your ideas? 3 hospitals later, because they would say, hold on for a minute and never come back to the phone. I called Grady, spoke to an internist there who actually called cardiology and brought them in on it because I was 25 minutes from Grady. Or actually I was going to, we call it Emory Midtown now, it used to be called Crawford Law. I was going there because she was I can't remember why she was high risk, but she was. And so to make a long story short, it turned out that I gave one other drug that I wasn't suspected that I didn't think about giving, and nothing really changed. But I was fishing for ideas, right? I was fishing for ideas. And so like you were fishing at that point for ideas. When you're fishing for ideas, you have to be specific. You have to really say, hey, what do you think will help this patient? And paint that picture very clearly for them so that they can come back with some more stuff that you didn't think about. Right. So we'll come back to that. I will give the rest of the team in because they may want to play off this. Go ahead.
Did you make a transport decision at all?
Yeah, we called ALS really, and then we switched to BLS a whole bit.
I think the team was just moving maybe a little too quickly, like nervously, like, oh, you can slow down a bit on that.
We had a couple of questions. At first, was the patient alert and talking? Were they able to talk to the patient right when they got on scene?
Yeah. She was altered from the entire scenario.
Because one thing that Jenkins had caught and that we had questioned on was the suctioning at the beginning. If she was able to talk to them.
Was she sitting up?
But she
grew up and then that's what it's like.
Yeah.
But you don't always have to suction people who are vomiting, right?
Yeah.
Is that where you're going with it?
Yeah, kind of. Like if they were talking to her when they first walked in and she turns and throws up,
We'll let them get done.
Yeah.
Yeah.
Before suction. So that was just something, and we didn't throw the yellow card because we didn't know, we weren't sure on the status of the patient. So we saw that, and then.
So there was a friend, if I'm not mistaken, in there with her, right?
That's what
Okay, so they were talking to the friend,
They
not
were.
the patient. Okay. But other than that, getting breath sounds or lung sounds. I don't know if anyone actually took lung sounds.
I
They
didn't
got
see that.
They got the respiratory rate.
But I will give Henny credit. Eyes directly on the chest.
He was. Could be
And that was good.
another one where we thought about maybe they missed his breathing, but yeah, that's what they kind of placed their hand on, and
Right.
we were looking the whole time. But other than that, I think everything went well. And like you said, you didn't jump to the diagnosing it. You just kind of kept treating until
think they covered everything.
So the question is, we have a patient with a blood pressure that's borderline, right? And the question is, do we give fluids? Right? Do we give fluids? She's hypoglycemic, barely. No, she's not even hypoglycemic. She's 60. So 60 is technically the bottom of normal, right? So let's think about what we know so far on the physiology behind it. So if one skin temp, color, and condition was diaphoretic, right? And you confirmed it because you said she's been vomiting, so she's kind of wet, right? Or is that word you used? Both clear, she was diaphoretic. Okay, so, and you did really good because right behind that, when you said, let's put her on some O2. Signs of hypoperfusion, oxygen. Bam. So if she is showing signs of hypoperfusion, we put the oxygen on because we want to saturate her with oxygen because we want oxygen to come into that cell and meet up with glucose to have the appropriate metabolism. So her metabolism is working really hard right now. She's, she is, we don't know for sure, probably, we're all guessing, probably not anaerobic, but maybe knocking on anaerobic's door, right? Glucose is low. And so that could be part of her history of bulimia too, though. But what is the goal of providing a fluid bolus? When we're giving fluids, what are we attempting to do? Increase or restore or maintain perfusion. Right, absolutely. So what you can do a couple things. You could check for orthostatic vital signs, but I bet you she wouldn't be able to stand up. Just from the picture I had in my head of this. Okay, so if she can't do orthostatics because she's too weak to stand, then we're going to consider that a positive test, meaning she's orthostatic. If you're ever doing orthostatics, you stand somebody up and they go, oh, I'm really dizzy. That's all you need to hear. Go ahead and sit back down. That's a positive test. Positive test at that point. So if she then shows signs of being in a situation where she's hypovolemic, how do we treat hypovolemia? Fluids. So what's your fluid bolus for a hypovolemic patient? How much would you want to get? Now, that's different than cardiogenic shock. We're talking hypovolemic shock. You don't know? Does anybody on the team know? You know? So we're talking hypovolemic shock. Well, no, that don't work because it depends on how much she weighs, right? Depends on how big she is. I might need more fluid than somebody else. All right, evaluation team. How much fluid do we give a patient who's in hypovolemic shock? That's for cardiogenic shock. How much? You're close. Does anybody know how much we give, how much fluid we administer to a patient who's in hypovolemic shock? What you said?
36.
Not 3,600, but the math might come close to that.
Milligram per kilogram times 3.
What did you say?
Milligram per kilogram times 3.
Not times 3.
It's 20 ml per kg.
20 milliliter per kilogram, say normal saline bolus. 20 mLs per kilogram of normal saline bolus. And so, which would lead you then to think, well, do I have a 200-pound patient here or do I have a 98-pound patient? Because their blood pressures are going to be a little different sometimes, right? And so therefore, if you guys had asked, well, how much does my patient weigh? Because would it make a difference to paint a picture for you? Because if I'm 200 pounds, I'm sitting in the bathroom floor, and my blood pressure is that versus a smaller person. A smaller person, the blood pressure you have, not too bad actually. If my blood pressure is that, you might think a different story. So get a weight on your patient, right? But either, irregardless, in this case, whether I'm 200 pounds or 90 pounds, with those signs and symptoms that you have, you need a flu bolus. So 20 milliliters per kilogram, find out your weight, and then do that. So med control. Next time you get a picture painted to you of a patient who has stable, sounds like stable vital signs, right? But she's vomiting blood. She's too weak to stand. If they paint a clear picture, then you'll know. Let's do a flu bolus. So in this case, let's talk about the D50. How many of you guys feel like the administration of D50 was appropriate in this situation? But 1, 2, 3.
I thought it would hurt because she was vomiting.
Okay.
No pneumonia.
So 4.
Wouldn't hurt.
How many people feel like the given the D50 was not appropriate in the situation? Some of y'all just don't want to vote. Some of y'all are like, hell with it, I'm not voting. Nope. Nope. So the D50 in this case, not gonna hurt. Just not gonna hurt. She's at 60. We give her, it never hurts to give D50 if you think they need it. If you don't give it, you could hurt a little more. But if you think the patient needs D50,
Is there any special considerations for bulimic like type of patients who are known to just not keep?
there is one, well, they're not for giving D50 now. So there is a a field impression that you could go with. And you said it. What did you say earlier? Yep. Mallory Wise. And that was exactly what this picture I was getting was kind of thinking that. So, but missing that's no big deal, right? Missing that's no big deal. Not giving the fluid bolus in this case probably wasn't going to change your outcome, right? But it would have been good patient care. As far as handling the primary assessment, did great, right? Handling the secondary assessment did great, right? We don't always get it right to a T, but by not administering the D50, but you did, or by not giving a fluid bolus, which you didn't, probably not going to change your outcome, right? But and so I wouldn't like, I don't mind that. I mind it when we do other things that could hurt or make the patient more life-threatening. But in this case, I don't mind that. But we learn from it. So it's a good scenario to learn from. And so that's why you have to keep in mind, what type of shock am I dealing with? Cardiogenic shock with that pressure, 250. It's a 250 milliliter bolus. Why? Why is cardiogenic shock different with a fluid bolus versus hypovolemic shock? Nope, that's neurogenic. So the fluid's not going. You don't want to overflow it. Both of y'all are right. Because what's going on with the heart and cardiogenic shock? What's the essence of cardio? It's not able to pump correctly. It can't contract normally. And so if my heart can't contract normally, what's going to happen if I add more fluid to it? I might increase preload a little bit, but at the same time, at the end of the day, I can't do anything with that fluid. It goes into the vascular area and it's I'm going to increase pulmonary edema. So let's do a 250, right, to see if that helps, right? It might buy us some time, but either way, we're going to have to account for 250 milliliters of fluid going to a sick heart that can't do anything with it. It might help at the beginning, but at the end of the day, we got to figure out how to make this heart pump stronger to fix it. Make sense? That's why it's 250 for cardiogenic. Hypovolemic, we have a volume problem. we have a good heart, fill them up. Right? Especially if it's a volume problem and we're not losing whole blood. Blood cells are still there. They just have a problem getting around. So let's give them the Uber that they need. Special attention though, if I'm losing blood, if I'm having whole blood loss from a ruptured vessel, etc., be careful because I'm losing platelets. And I don't want to wash away my platelets, right? We can't replace blood. We can't replace red blood cells that carry oxygen. And so you don't want to wash those away. Remember how the platelets aggregate on a clot? They'll aggregate to that point of where you're hemorrhaging at. We want that to happen. That helps to slow down or stop the bleeding wherever it's happening. Now, if you start adding pressure to the system, what's going to happen? Those platelets are going to move away. You're going to push them off. You're pushing them away. That's why in Vietnam, right, they said we will have we'll have more life saved in this war than we did in World War II because of medical science. We have IV fluids. We have all this stuff. Everything's going to be great. Guess what happened? They started looking at it and said, well, shit, we're losing more people. We're losing the same as we lost in World War II. Why? And they figured it out. They said these IV fluids are causing the patient not to clot. And so they, instead of doing something about it then to help us out by giving whole blood or blood products, they said, we'll just turn the rate down a little bit, be okay. And give them some morphine. Yeah. All right. So that's how that all came about. All right. Thank you. Appreciate that. You watched it? Well, if anybody else watched it, you're lying. It's got like 5 or 6 views. 2 of those views, I think, are me clicking on it to show the intro. So I like the intro. You like the intro? Intro's pretty cool. I said, you play it, mate. He's like, oh, well, I know, I'm just kidding, mate. All right, so look, take a 5-minute break, go to the bathroom, come back in, let's do this test review, and then go to lunch.
That's hilarious. It's either 22 or 27. Yeah, it's not really a video. He pulls up a couple of pictures, but really it's all. Just go on your phone and just listen on the way home. That's not it.
Or not. We thought she was 7.
I listened to it while I drive.
I was laughing. I was laughing at his section.
I had to keep.
Okay, so if you didn't do a what you call it, a study guide, you won't mind taking